Sir, now we are good to go. We are on time.
Fine, yeah. So, very good afternoon to all the respected doctors. On behalf of Hetero Healthcare, we welcome all the doctors for the webinar. Topic for today's webinar is the missing link in your enzymatic preparation. To shed the light on the topic, we have with us Dr. Sathish Kumar. So, I'll just give a brief introduction about Dr. Sathish Kumar. So, Dr. Sathish Kumar is a MDS periodontist and implant surgeon. He has more than 15 years of experience in surgical and implant cases. Dr. Sathish Kumar is a well-known speaker at various IDA events. Dr. Satish has a YouTube channel in name of Kazan Dental, and he has almost 15,000 followers on that Kazan Dental channel. Dr. Satish has authored two books, VDS Launchpad and Dental Launchpad. So this is a short brief of Dr. Satish Kumar. So we welcome Dr. Satish to the webinar. And Doctor, a small message to all the participants during the webinar. If you have any questions or queries, you can type it in the chat box. Dr. Satish will answer those questions at the end of the session. Okay, so I hand over the session to Dr. Satish. Dr. Satish, you can start.
Thank you, Dr. Nitin.
Thank you.
It's amazing. मतलब हर बार मैं जब भी ये चालू करता हूँ, whenever we start this session in the afternoon, it is great to see that there is always an audience. And it's not just that there are young dentists out there who are listening and trying to understand. It's even senior practitioners who are taking out time to come and listen to these sessions. So it makes me wonder कि हम dentist इतना क्यों पढ़ते हैं? Why are we so interested in learning and upgrading ourselves? We take out time, if you're going to clinic in the morning and the evening, we take out some time in the afternoon and we try and learn more about dentistry. Saturday, Sundays, we take out time and attend courses. If not, we travel to different cities, countries and learn stuff and come back. हम लोग इतना मेहनत क्यों करते हैं? Why do dentists keep on learning? If you ask various dentists these questions, the simple and easiest answer I get is I want more money. जैसे हम लोग गुजराती में बोलते हैं ना, धंधा, पैसा चलना चाहिए, तो जितना मैं सीखूंगा उतना मैं ही ट्रीटमेंट कर पाऊंगा और उतना ही मुझे पैसा मिलेगा. Second, people tell patience चाहिए. I have decent patients, but I want more number of patients. Third, they will say that the more I learn clinical skill, the more I'm able to do better treatment. That is when I get satisfaction from my work and the patients respect me. And once my patients start respecting me and I am good at my work, even my peers, the other dentists, start respecting my clinical skill. But I want to ask a question is सबका solution क्या है? When are you going to get more money? When are you going to get more patients? And when are you going to get that satisfaction and respect? The answer is happier patients. The more patients are happy, the more they are willing to get treated at your practice and they are willing to spend for higher end treatments. Similarly, they would refer other patients to your practice, increasing the number of patients in your practice. And third, when this happens, there is a satisfaction that you're giving good quality treatment and you're gaining more respect. But क्या आपने कभी सोचा है, what do patients actually want? And it's not just one type of patient who walks into your practice. You have that old uncle whose teeth are completely shaking and with shivering hands he might walk into your practice. You might have that young male or a female walking into your practice, working in an IT, running their own business, an entrepreneur, or someone who's an employee, having different expectations. Then there is that kid. There are different types of them. One would be smiling, happily entering. The other will be holding their parents' hand and slowly peeping into the practice as they are scared to enter. What do all these patients want? How can you make these patients happy? If you normally ask dentists, what is the answer? They will say, मेरे patient को तो discount चाहिए. Discount दिया, patient खुश. But I want to ask you a question. Have you not seen clinics where there are a lot of patients and the charges are not extremely low? They are charging a bomb. Then there are practices where their charges are absolutely minuscule. एकदम कम charge करते हैं, फिर भी patient नहीं है practice में. Have you seen that? So I want to ask you, is it actually only discount which matters? Forget about patients. I want to ask you, you would always pride yourself by saying कि मैं सस्ता सामान चाहता हूँ, मुझे डिस्काउंट चाहिए, मैं बार्गेन अच्छे से करता हूँ. But is it always the bargaining which matters? Are you always going to the discounted shops and buying stuff? At the end of the day, there is something known as quality you feel. Something where you feel I am getting a better deal out of it. You are willing to spend more at times. And remember, the patients you treat are from your area, your surrounding people. They have usually a similar mindset to yours. So they are not always looking for discounts. Many of them are willing to spend. Then you would tell me that they are looking for good quality treatment. My question is, do you remember that patient who walked into your practice with like a 4 or a 3 mm short obturation in a root canal done somewhere else, and the patient has absolutely no pain? And when you do a perfect obturation, the patient has pain, and then they come and tell you कि आपने जो रूट कनाल किया ना उसमें दर्द हो रहा है, ये जो रूट कनाल मैंने 10-15 साल पहले किया था उसमें तकलीफ बिल्कुल नहीं है. Now what is the ideal treatment? Obturating just 1 mm short of apex, which you followed the rule, and the other person didn't. Still, the patient is not considering the ideal treatment as the best treatment. So, what does the patient actually want? The first thing is they want basic function. मुझे खाना खाने आना चाहिए. I should be able to eat what I like, when I like, how I like, what to eat it. Second, it should be aesthetic. दिखने में अच्छा लगना चाहिए. जब मैं हंसूं सब बोले कि क्या स्माइल है. Third, during the procedure and after the procedure, there should be less or no discomfort. If you can give these three things to your patients are always happy. So they are function, aesthetics, and less or no discomfort. Another point is फंक्शन और एस्थेटिक्स के लिए आप क्लिनिकल कोर्सेज सीखते हो, आप अपना क्लिनिकल स्किल बढ़ाते हो, आइदर खुद करते हो या स्पेशलिस्ट को बुलाते हो, एंड यू सी दैट गुड क्वालिटी ट्रीटमेंट इज गिवन टू योर पेशेंट्स. हाउ डू यू सॉल्व फॉर डिस्कम्फर्ट आफ्टर ट्रीटमेंट? Since ages, to solve that problem, we have been prescribing medications. Usually what we give is antibiotic and a painkiller. Now what does antibiotic do? It helps control the infection. What does the painkiller do? It reduces pain. But why does this pain happen? हम लोग painkiller क्यों देते हैं? Painkiller is basically, or the pain is basically a sign of inflammation. Means body का एक reaction होता है. Inflammation is basically a reaction to any trauma. It can be physical trauma, irritating chemicals, viruses, bacteria. Body का एक reaction होता है to an injury, which is usually a localized spot. मतलब अपने दांत निकाला या patient को infection हुआ है. So it's a body reaction in a localized region. And the signs are basically 5. There is heat, redness, swelling, pain, and at times loss of function, जिसको functional acia बोलते हैं. Dentistry में we deal with mainly 4 of the signs, that is heat, redness, swelling, and pain. Patient usually complains of pain and swelling. Loss of function only happens maybe अगर आपने एक wisdom tooth निकाला and because of the swelling they are not able to open their mouth properly. That is usually the complaint they might have, which is usually rare. So mainly our patients are suffering from pain and swelling, and this is what they tend to complain. Now this inflammatory reaction is not always same. It could be acute, like in the cases where we are doing a given dental procedure, or it can be chronic, which is continuously irritating the body over a long period of time. Chronic inflammation has long-term harm, causes long-term harm to the patient. It can have cardiovascular diseases, neurological diseases, it can even lead to cancer. What we as dentists are mainly dealing is with acute inflammation. मतलब अभी चोट लगी, अभी patient ने reaction दिया. That is an immediate body reaction or response. Now, why does this happen? Inflammation होता क्यों है? Why do patients end up having pain and swelling? Let's understand the mechanism. इमेजिन आप रोड से जा रहे हो, बाजू में आपने देखा एक एक्सीडेंट हो गया है, ठीक है? What usually happens in the accident site? Once there is an accident, the person who is injured will either end up, they or their relative will end up calling the ambulance, they will end up calling the police, and they will end up calling their friends and family so that the situation around there is taken care. Now, other than them, there are 10 people who are standing in the area. जो बाजू से बाइक जा रहा है, जो स्कूटर में जा रहा है, जो गाड़ी में जा रहा है, सब लोग अपना गाड़ी उधर पार्क करके देखते हैं. They become standby viewers कि चल क्या रहा है. Everyone wants to know what is happening. This is similar to what happens in an inflammatory reaction. When there is an injury, there are certain mediators from the cells. अगर वो जो टिश्यू को इंजर हुआ है, वो certain reaction या mediators भेजते हैं, and they ask plasma cells to come and help them and seal up the site. जिसकी वजह से you end up having clotting, you end up having bodily reactions like fibrin creation, sealing of the site, healing of the site. But along with this, there are other excessive tissues which are not required in the site. For example, excessive plasma might get deposited. There might be more than required macrophages which might enter the site, causing a lot of irritation and swelling out there. Now, imagine this keeps on increasing. Then what happens? You end up having an irritated site out there. So our aim is to try and reduce this inflammation as and when it happens. Now these mediators जो कॉल करके लोगों को बुलाते हैं are of two types. One is plasma derived and one is cell derived. Cell derived means जहां पे इंजरी हुआ वहां के cells कुछ mediators भेजते हैं which end up calling certain cells. Second, when there is an injury, the nearby blood vessel gets punctured or opens up. Vascular dilation होता है, मतलब वो थोड़ा सा खुल जाता है. So all the cells can enter into that injured site or tissue. Soon as they enter, they also release mediators कि वो अपने दोस्तों को और बुला के लेके आते हैं. Those are known as plasma protein derived. Now, why is this important? ये मुझे फिजियो में फर्स्ट ईयर में बीडीएस में सिखाया गया था. As a dentist, मुझे फर्क ही क्या पड़ता है, मतलब मैं क्यों सीख रहा हूं? The answer is, as dentists, we are dealing with trauma every day. Trauma doesn't mean just an injury and the tooth is off. Trauma can be an extraction site. Trauma can be the drill you have done to create an implant site. Trauma is the normal stitches or suture you are giving out there. Any injury which you are causing to the site causes a inflammatory reaction. क्या हम लोग जानबूझ के दांत निकालते हैं? Do we enjoy removing teeth? Absolutely not. We remove the teeth so that you are helping the patient from long-term pain. So what do? You're creating short-term pain and inflammation. मतलब long-term gain के लिए हम लोग short-term pain या problem create कर रहे हैं, जिसकी वजह से inflammatory reaction होता है. So when you do an extraction, you are causing inflammation. When you're placing an implant, you're causing inflammation. When you're suturing a site, you're causing inflammation. So you are traumatizing the body, because of which the patient can end up with pain and swelling. And remember in the start, हमने डिस्कस किया था पेशेंट को क्या चाहिए, फंक्शन, एस्थेटिक्स एंड लेस डिस्कम्फर्ट ड्यूरिंग प्रोसीजर. मेजॉरिटी पेशेंट्स क्या बोलते हैं कि हम लोग डॉक्टर के पास क्यों नहीं जाते? पहला, बहुत खर्चा होता है डेंटिस्ट के पास. दूसरा, मुझे डेंटिस्ट से डर लगता है. डर किस बात का? इलाज करते वक्त और कराने के बाद आई एंड अप हैविंग पेन. Why does this pain happen? It is because of inflammatory reaction. Yes, during the procedure, to avoid pain, we are giving anesthetics, we are using nitrous oxide, all those mechanisms. But we also need to take care of pain, swelling, post-procedure. Do you remember that patient जिसका आपने दांत निकाला था? एकदम easily निकला, but बाद में patient को बड़ा swelling आया. Patient क्या बोलता है कि मुझे बहुत तकलीफ हुई दांत निकालने के बाद. Now, I want to give you a situation where patient went to two clinics. One clinic, he got an extraction done. Post-extraction, no pain, swelling. Second clinic he went, he got a tooth extracted. Post-procedure, he ended up having pain and swelling. During the procedure, दोनों clinic में उसको कोई भी discomfort नहीं हुआ. Where will the patient go again? Obviously, where in the clinic where he didn't have post procedure pain or discomfort. उसे नहीं पता कि वो पहले वाले क्लिनिक में ग्रेड 3 मोबाइल निकाला था और यहाँ पे सर्जिकल एक्सट्रैक्शन हुआ था. His assumption is I have removed a tooth where I do not have discomfort post procedure. वहां पे काम अच्छा हुआ है, वहां के डॉक्टर का हाथ अच्छा है. Simple logic which our patients tend to stick to. So as dentists, if you want to have happy patients, your aim is to see that post procedure उनको पेन नहीं हो. और इतने सालों से हम लोग क्या दे रहे थे? सिर्फ पेन किलर. What is painkiller? Basically, what we give is NSAID, non-steroidal anti-inflammatory drugs is what we are prescribing. But in today's day and age, when you have to look at reducing pain and swelling of your patients, where the patients are becoming more demanding, you need to understand in which stage of healing are these medicines given. Are you giving antibiotics and painkiller for hemostasis? No. For that, you're giving a cotton plug or a suture. Are you affecting the proliferative rate by these medicines? No. Are you affecting the remodeling? No. So your aim is inflammation. So are there other medicines other than NSAIDs which can help this? And in today's day and age, we have such medications available. One such medicine is Tolib. Now, why do I personally prescribe Tolib? It has certain enzymes which have been proven to be effective. But I know you are not a random dentist कि मैंने बोल दिया आपने prescribe किया. It is important that you understand कि ये patient को क्यों दे रहा हूँ, patient को इससे फायदा क्या है, कुछ advantage है क्या. So understanding each and every enzyme, how does it act and why you should prescribe it is essential. So the first medicine is trypsin. Now trypsin is an enzyme which is already produced in your body. याद है वो फिजियोलॉजी में सिखाया गया था. Trypsin is one of the enzymes in the entire sheet. It is created in the pancreas, enters into the intestinal system through the pancreatic duct into the duodenum. तो एक एंजाइम जो बॉडी ऑलरेडी प्रोड्यूस कर रहा है, हम लोग और दे रहे पेशेंट को. लॉजिक क्या बनता है उसके पीछे बॉस? द आंसर इज इट हैज 3 major actions. First is it helps reduce vascular permeability. याद है मैंने स्टार्टिंग में बोला था that when an accident takes place, the blood vessels expand and blood cells enter into the injured site from these. So what happens if you reduce the vascular permeability? It reduces the movement of those cells, hence decreasing swelling and inflammatory reaction there. Second, it reduces pro-inflammatory cytokines. याद है मैंने बोला था कि लोग कॉल करके अपने दोस्तों को बुलाते हैं देखने के लिए एक्सीडेंट हुआ है. Similarly, the cytokines call in various other cells into the area. These cytokines or mediators are suppressed by trypsin, again reducing inflammation. Third, imagine आपके घर पे कुछ या आपके क्लिनिक के कुछ वॉल पे डैमेज हुआ है. What would you do? You would call the people to repair it. The laborers will come, they'll put the tiles, they'll put the bricks and they will paint and everything. Imagine उन्होंने सब काम कर लिया और उन्होंने उनका पूरा सामान वहां पे छोड़ दिया. Just leave it there and go. How would your clinic be? Bad, right? You want them to clean up once the work is done. Similarly, during the clotting phase, you need fibrin activity, you need healing out there. But once that is done, you need the excessive fibrin to be removed so that there is less swelling due to pressure created because of the tissue cells out there. For that you need fibrinolysis, means वो excessive fibrin को निकालना, and that is done by trypsin. So trypsin provides 3 amazing roles out functions out here. That's why we prescribe trypsin. But I know your next question would be, ठीक है trypsin ये सब करता है, पर are there articles to prove कि ये फायदेमंद है? मतलब किसी ने दिया है क्या मेडिकल में? एक होता है प्रैक्टिकल, एक होता है थियोरी. थियोरी shows yes, but practically is it effective? And the answer is yes. Our MBBS colleagues or peers have been prescribing trypsin since long for various areas especially in anti-inflammatory cases and for the thrombolytic properties. It is given in various ulcers, rheumatoid arthritis, and also in ocular disorders. Imagine आई में दे सकते हैं, तो दांत के swelling के लिए क्यों नहीं? So when you know an enzyme is effective, what is our job? To use it for our advantage. ये हो गया ट्रिप्सिन. उसके बाद आया ब्रोमेलिन. Why would you prescribe bromelain? Have you ever thought bromelain आता कहाँ से? Pineapple. If you like pineapple, you are taking in bromelain. Now this, why would you take an enzyme from a fruit and give it to your patients? The answer is bromelain is like a superman. It has various superpowers. First is it reduces the levels of prostaglandins, mainly PGE2. What is it? केमिकल मीडिएटर जो हमने स्टार्टिंग में डिस्कस किया था, जो बाकी सेल्स को साइड पे बुलाता है और स्वेलिंग इन्फ्लेमेशन इंक्रीज करता है. सेकेंड, it again inhibits bradykinin. This is also a mediator. Third, it reduces tumor necrosis factor alpha and interleukin 1 beta. Fourth, it prevents platelet aggregation. Remember trypsin में हमने क्या बोला था? That once the fibrin is formed, once everything is swollen, it helps cleaning up the mess. Bromelain prevents the mess happening from first only. So if you feel there is excessive clot formation going to be out there, bromelain prevents that. It prevents platelet aggregation, hence reducing inflammation from the start itself. And similar to trypsin, bromelain has already been prescribed by medical doctors successfully. It is been seen to be used in arthritis. They did a study in cases where sports injuries हुआ था लोगों को. Before surgery, they started giving bromelain, and post surgery, they saw that जो patients को bromelain prescribe किया गया था, they healed faster and better. So again, we have an enzyme which is successfully used by our MBBS peers. So what is stopping us dental surgeons from using them? Third, rutoside. Now rutoside is found in blackbuck, tea, apple. It's easily available. And why would you take this and give it to your patients? Similar to trypsin and bromelain, you need to understand the advantages. It has inhibition of platelet aggregation. It decreases the vascular permeability, improves vascular flow. Now this is different from the previous two. Improves vascular flow means not just closing up the cells, it helps the plasma flow through so that it does not enter into the tissue site. How does it do this? By strengthening the capillaries, it reduces the edema out there. Similar to bromelain, it also acts on interleukin 1 beta and tumor necrosis factor alpha. Now, is rutoside being used before? Why should I experiment with my patients? And the answer is rutoside has also been used before by MBBS doctors. It is being used in various inflammatory situations such as human arthritis. Now, when we know an enzyme is being used by our MBBS colleagues, it is our duty to try them for our patients and to see if they are beneficial for our patients as well. Now comes the fourth and the game-changing enzyme. The previous three enzymes I spoke about before are also available in other drug combinations. But the drug provided by Hetero Healthcare, Tolib, has this additional enzyme papain. Imagine बहुत सारी कंपनीज 3 एंजाइम ऐड कर रहे हैं एंड हेटेरो हेल्थकेयर ने अपना कॉस्ट बढ़ाया, एक एक्स्ट्रा एक एंजाइम डाला, वो भी पैपेन. ये पैपेन होता क्या है? इट्स बेसिकली गॉट फ्रॉम पाइनएप्पल, पपाया. हैव यू सीन पपाया प्लांट्स जब वो रॉ होते हैं हैंगिंग ऑन द ट्री? इमेजिन दोस ग्रीन प्लांट्स व्हेन दे आर हैंगिंग ऑन द ट्री, देयर आर कट्स गिवन टू देम. वो कट्स में से एक व्हाइटिश लेटेक्स आता है. वो लेटेक्स में से this enzyme is derived. Imagine you already have 3 enzymes. आपने कष्ट किया और एक और फोर्थ एंजाइम एक ड्रग में ऐड किया. Really, why does this make sense? And the answer is, when you look at its advantages, you would understand it makes absolute sense. What are the advantages? It strengthens the blood vessels, it has anti-inflammatory action, it has antioxidant properties, and it improves microcirculation in the area. Not just that, papain has also been one of the enzymes which has been extensively been researched, seen to be effective not just in normal injuries but also in foot ulcers, leg ulcers, pressure ulcers. In burn cases, also they have seen to be extremely effective. Imagine in severe inflammation, if it is effective, what will be the advantages in just a minor inflammatory case? It would be extremely great. एंड वाई डू यू एड ऑल दीज एंजाइम्स टुगेदर, मतलब आप एक एंजाइम क्यों नहीं देते हो, चार क्यों देते हो? इट्स बेसिकली जो हमने बचपन में पढ़ा था of BDS, that's known as your synergistic effect. Synergistic effect is when the enzymes work together, they act better on the patient rather than individual enzymes. That's why having a combination of these four enzymes is proven to help reduce pain, swelling, and inflammation around the wound. Now, for all the smart dentists out there, आप सोच रहे होंगे कि ओके, MBBS डॉक्टर्स ने ये यूज़ किया है, इफेक्टिव है, थियोरी बता रहा है कि इफेक्टिव है, डेंटिस्ट्री में एक्चुअली फ़ायदा है क्या? माई पेशेंट्स आर ऑलरेडी पेइंग एक्स अमाउंट फॉर ऑल द एंटीबायोटिक्स एंड पेन किलर, शुड आई ऐड दिस? माई क्वेश्चन टू यू इज, हाउ वुड यू नो इफ इट इज़ इफेक्टिव? अगर मैंने आपको आके एक ड्रग दिया और बोला कि बताओ कि इफेक्टिव है कि नहीं. Imagine you're doing a same procedure on 20 patients. अब 10 लोगों को एक ड्रग दोगे, 10 लोगों को वो ड्रग नहीं दोगे. फिर आप डिसाइड करोगे कि जिनको आपने वो मेडिसिन दिया, have they seen any advantage compared to the ones who were not given that medicine? Correct? This exact study was done by the topmost college in India, Savita Dental College. What did they do? They found total of 40 patients who needed third molar surgical extractions. 20 लोगों को उन्होंने टॉलिप दिया, 20 लोगों को टॉलिप नहीं दिया. And post procedure, they analyzed those patients. And I want you to personally read what is written there. The conclusion states that use of papain appears to be associated with reduction in soft tissue swelling and improved mouth opening when compared to conventional therapy or placebo. So using this, if you go further and read the entire article, you will see that they saw that pain was less, swelling was less, and post-surgical, the discomfort the patient faced was also less. And we have spoken this in the start. हमारे पेशेंट्स को तीन ही चीज चाहिए, फंक्शन, एस्थेटिक्स एंड लेस पेन. हमें क्या चाहिए? पेशेंट खुश रहे. अगर हमें पता है देयर इज अ ड्रग इन द मार्केट विच इज अवेलेबल विच कैन डू दैट, what is stopping us to prescribe that? The second most important thing to remember is this drug is being produced by Hetero Healthcare. Hetero Healthcare is not a small company. It is present across 120 countries in the world, and they do not make just this one product. They make a lot of products for a lot of categories, not just dentists. Why is this important? Remember that incident which recently happened in a government hospital? Doctor ने prescribe किया and few kids lost their lives because of it. We know for a fact that in our country there are certain companies which are creating substandard medicines. We do not want to be prescribing that to our patients. So we know a standard brand has come up with an added advantage medication which we can prescribe to our patients. So that after procedure patient says, आपने प्रोसीजर करने के बाद मुझे बिल्कुल दिक्कत नहीं आई, मुझे बिल्कुल स्वेलिंग ही नहीं आया, समझा ही नहीं मुझे, आपने जो मेडिसिन लिए वो मैंने टाइम पे लिए. Do you want your patients to say that? If yes, you should be prescribing Tolib. Now the question arises is, what is the dosage of prescription and when do you prescribe it? I would suggest prescribing wherever you expect a inflammatory response, that is extractions, surgeries, implants, disimpactions, jaw fractures, जहाँ पे भी तुम्हें लगता है कि पेशेंट को swelling या severe pain होने का चांस है, you should prescribe it. Now what is the dosage? They say the standard dosage is twice daily for as long as required. As long मतलब क्या? As a dentist we know, हमने कोई भी प्रोसीजर किया, पेशेंट को कितने दिन प्रॉब्लम होता है? 3 to 7 days, correct? So if I've done an extraction and the patient is going, it's a grade 3 mobile, I may prescribe it for 3 days. But if I'm doing a proper firm tooth extraction where I'm giving my antibiotics and painkiller for 5 days, I will prescribe this for 5 days. Where I'm doing an additional procedure like a GBR or direct sinus lift, where I'm prescribing patients antibiotics and painkillers for 7 days, because I'm expecting pain and swelling, I would add this medication for a duration of 7 days. So you should give it for twice daily, depending upon how many days the patient you think would have an inflammatory reaction based on the procedure you do. If you're starting up your practice and your all extractions are traumatic and always you prescribe for 7 days antibiotics, then add this for 7 days. Should you prescribe it to all patients? कुछ side effects है क्या? The answer is similar to जो हमने फार्माकोलॉजी में पढ़ा था. याद है? आधे से ज़्यादा ड्रग्स का क्या था साइड इफेक्ट? Nausea, vomiting, diarrhea, NVD. Similarly, the commonest side effect of this is nausea, vomiting, and diarrhea. But care should also be taken if patient is already on an anticoagulant therapy. Why? याद है हमने बोला bromelain prevents platelet aggregation. If already the body is not letting platelets aggregate, do you want to stop the procedure further? Absolutely not. So there are very few contraindications, but one of those is if the patient is already on a blood thinner such as warfarin. Second, if the patient has certain sedative drugs. Third, which is actually not a contraindication, but I would still advise you not to prescribe, is in pregnancy and lactation. Reason is, अब तक उतना research नहीं हुआ है that we know if there is any side effect or not. But it is always, as doctors, first our aim is do no harm. So why prescribe something which you do not know if it might have a side effect or not? So only 3 conditions where you should avoid prescribing Tolib is: first, blood thinner; second, if the patient is on certain sedative or psychotropic drugs; third, if the patient is either pregnant or lactating. Other than that, in all cases where you expect inflammation, prescribing an extra combination enzyme from a standard company which would reduce inflammation and make your patients happier, hence making you happier, is something which you should do. With that, we end today's session. If there is any doubts, you can ask them.
Participating doctors, if you have any questions, you can just type in the chat box. There's a chat box below. If you have any doubts or questions, you can type in at the chat box. Yes, there are no questions so far. So far, so good. So yeah, thank you, Dr. Satish, for this insightful session on Tolib. I hope most of the questions and doubts are cleared, and Tolib as a product will be more clearer to the dentistry and dental field as well. So thank you for a valuable time. Thank you for this productive session as well. Thank you so much. So we end the session here, participants. We end the session here. Thank you for joining in.
Hello.
So yeah, Bhuvan, hello.
Yes, sir.
We discontinue. Yeah, I mean the session is over.
Sorry, sir.
Session is over. Yeah.
Okay, sir. Thank you.
Okay.